May is Mental Health Awareness Month. There are so many who struggle with mental health issues. My hope today is that we will come out and be advocates for those who struggle, that we will help end the stigma, that we will start the conversations, that we will be there to listen to those that may need a listening ear.
Hi, I'm KJ, and I'm one of many people who suffers with an eating disorder and anxiety and depression. And I just would like to come out as an advocate for all of those, that you can overcome it, and although it's a daily struggle, you can do it. For me, it was difficult to own up to my feelings and thoughts, but doing that has made all the difference. You just have to reach out and you have to get help if you haven't yet. And if you have, that is just the first step. And I'm here today to start the conversation about mental illness and end the stigma. There are many organizations out there that you can reach out to for help, and one of them is Bring Change to Mind.
Hi, I'm Stacy Brimhall. I'm 52 years old, and I've been suffering with depression since I was diagnosed with it at 25. It's been an incredibly challenging disease, but it is a disease, much like cancer or a broken bone or any other kind of an ailment. It's not the fault of the patient, but for me, it's genetic and in my family for many generations. At 25, when first diagnosed with it, I was devastated. Didn't know how to deal with it, was concerned about what other people would think, and was hospitalized actually for 2 weeks. As going through the hospital experience, going through the life-changing event, and how to deal with it, there's a couple conclusions that I came to over time. One is that I determined that I would not give up and I would not be beat. And I repeat that to myself many times. Now, I have good days and I have bad days. But the one thing that I do know is that I will never give up and I will never be beat by this. The other thing that I learned to do is to get up. Sometimes in the morning it's incredibly difficult. You want to stay in bed, and I understand that. But getting out of bed and getting up, and even if you can only do very mundane things, get up and do them. That's half the battle, is getting up and showing up.
My name's TC, and I struggle with an eating disorder. I started struggling when I was young, and surprisingly enough, my biggest struggles came as I was an adult. After I was married and had children, and I ended up in an inpatient facility. Eating disorders are real, and they require help and support. I have learned in my own recovery that owning my story and being authentic and talking about where I am and who I've become and days that I struggle is really key in my recovery. It's people who struggle with eating disorders, I would hope that they can reach out without feeling ashamed, and that they can ask for help and reach out for that support. More people struggle with eating disorders than you would think. It's real, and those that reach out, embrace them and love them because they need it.
You can do it, and all of us stand together.